Welcome to The Holistic Nurse with your host, Peggy Smith. Peggy will introduce and educate her viewers about the differences between alternative, holistic, and complementary medical therapies. Her goal is to empower the lay medical consumer to learn how to advocate for themselves. So now, please welcome the host of The Holistic Nurse, Peggy Smith.
Hi, everybody. Welcome to this week's edition of The Holistic Nurse with Peggy Smith. This week, we are going to be talking about the joys and challenges of being a caregiver and how you can, if you find yourself in that position or if you're already there, how you can understand what your role is. And I have Dr. Gloria Warren, who is actually a full-time caregiver in addition to a health professional. She's joining us today to share her actual hands-on perspective that she's experiencing right now, as well as her professional expertise. Welcome, Gloria. I'm happy to have you today.
Thank you for having me.
So, um, caregiving, back in the day, I guess, when we were growing up, it was almost expected that you had to if you had a family member and you don't normally get advance notice that your family member suddenly needs 24-hour care. Um, and, sometimes it's a matter of there's no financial support to go to a facility if that was going to be your option. Uh, and there's often not a lot of support financially to instantly become a full-time caregiver. Um, Introduce yourself and tell us what you're experiencing right now with your mom.
Oh my gosh, a plethora of things. Yep, I'm Dr. Gloria Warren, and I'm a certified epidemiologist with Johns Hopkins. I have a doctorate in research and been in the medical field for at least 40 years. I mean, I started when I was like 16 years old. So, anyways, though, I am a full-time at-home caregiver for my mother, as well as trying to juggle everything else in my life. And there's struggles throughout, which I'm sure you're going to mention many things that today, Peggy, that I'm just going to really like, oh, yeah, that's so true. I think the basic thing for me being here is if I can just add to some of the information of that Peggy provides, I think that would really help. This is for at-home caregivers, not to say the caregivers you may have that come in and out who probably have further training and things like that from the get-go. But, nobody knows everything. And it's okay if we don't know everything. And it's okay that it may be new to us as well. So um, I guess we can just get the ball rolling with whatever key points you
Okay.
want.
Well,
Mm.
as you're talking about what's okay and what's not okay, I want to start off by saying it's okay if you're not able to take on the role of a full-time caregiver. Whether it,
Mhm.
modern day families usually have everybody's working, sometimes more than one job apiece. When I was growing up, I experienced my mother. First, she took care of my nana for several years, um, who had what they called hardening of the arteries back then. It was a form of Alzheimer's. And until it was not safe, meaning that when she started like wandering down the neighborhood and getting lost, things like that, uh, for almost 15 years, my mother was the full-time caregiver, and I was like elementary and junior high age. So I grew up thinking that's just what you do. There
Right.
were times, the middle of the night, I'm 12 years old, and my nana, who was from Canada, used to wake up thinking that I was one of her coworkers when she worked as a before she was married.
Mhm.
And I had already learned on my own that if I just made her a cup of tea and gave her a couple of vanilla wafers, she'd go back to sleep. It didn't take that much time. But then my mother was always chastising me in the morning. Why didn't you wake me up? You shouldn't be doing this. You've got to go to school, making me feel
Yeah.
guilty. And I enjoyed the time with my grandmother, not understanding any of the dynamics. Then after Nana passed away, my other grandparents, my mother's parents, passed away, leaving an adult Down syndrome aunt. Alice was, I guess, in her 60s when she came to us. I'm still in school. I thought it was kind of cool to have somebody, a grown up, that could play kid games with me. She loved to play concentration. She loved to listen to Tennessee Ernie Ford, and we had a ball together. And it was an important part of, probably, it had an effect of how I ended up in a caring field to begin with, I'm sure. Uh, but I found myself as an adult married with 4 children under 6 in a similar situation with my mother-in-law. My mother-in-law was
Mhm.
only in her 50s when she passed away. She had all the complications of diabetes, a double amputee, bypass surgery for her heart, on dialysis for 10 or 12 years. And I just automatically trying to work night shift, have 4 kids under 6, I first we started off driving back and forth to my mother-in-law's house. It was only a couple miles away, but carting 4 kids with me, it got to wear on me, and so I invited her to live with us. She didn't wanna be a burden on me, and I had to explain nicely that it was more of a burden if I had to keep picking everybody up, going back and forth.
Mhm.
And we had a good 3 or 4 years where she stayed with us in a hospital bed. I got her to dialysis 3 times a week, and there were a lot of challenges, but I just assumed that's what I do. And because I had to work, and fortunately, nurses have flexibility in the hours they choose. It was my ex-husband's mother. We were still married at the time. He was supportive. He didn't know what to do. He certainly didn't want to do much of it on his own. Although his brother, my brother-in-law, said, "Why don't you just put her in a nursing home?" And I just didn't feel that that was right. But when my mom passed away, my daughter, who was the oldest at the time, she was 7, and she actually, a couple times when I had stepped out to go get some milk or something for the baby, she found herself, uh, emptying, pans of vomit, things like that. Dialysis days were rough, and it really upset me to see this, and, my daughter said, "But mommy, I don't want my mom to smell this. It's okay." When my mom passed away, I said, "When mommy and daddy need help, are you gonna take care of us as well as you help take care of my mom?" And her response was, "Are you kidding me? I'll make enough money to put you in a nursing home. I'd never do what you do."
Yeah.
And I was working home care at the time because that's one of the more flexible jobs a nurse can have when you have kids. And I realized, it's a different generation, different time, and having somebody at home is also not the best choice. Uh,
Mhm.
Financially, if somebody has to quit working to do that because you can't afford the full-time caregivers, that's more stress,
Mhm.
and not able to take care of yourself, you're actually not even appreciating and enjoying the time you have with your loved one. You become robotic and automatic, and you don't take care of yourself the way you need to be successful. Um, and so what I learned with my home care patients going forward was, it's not only not always the best thing, but it's okay to actually when my husband was on hospice, I had to put him in a facility because I needed to still continue working, and some of that old guilt that I grew up with was still there, but I realized, you know what? I have quality time when I'm here. If I was trying to work to continue our bills and take care of him, even with extra help, the stress would
Mhm.
have I wouldn't have been spending any quality time with him. And so today we just want to talk about some of the hacks and things that make it okay, and that just reassure you that if you need to take care of yourself first, or you're not able to take care of anybody else, and whatever choices are best for you, it's what's best for you. You don't have to feel guilty no matter what other people tell you.
Right.
There are
Unfortunately,
yeah.
yeah, unfortunately,
That's
society always, it makes us feel like we need to be emotionally available all the time and physically tireless and financially flexible and self-sacrificing without complaints. And the big myth of if I love him enough, I should be able to do this alone. And so we're here as for I'm here, for options. And there's things we'll talk about like burnout and love does not equal infinite capacity, and caregiving is a job, not just a relationship. It is an actual job. You're just not getting paid for it. So you do it out of the graciousness of your heart. But caregivers don't burn out because they don't care enough. They burn out because they care too much and without support. So I think we
And in the
should.
process of caring so much, it's easy to forget to care for yourself. And If you're not
Right.
getting enough sleep, if you're not hydrated enough,
Guilty.
uh, there's also a fallacy, I think, that nobody can do as good a job as you can. And
Mhm.
that may or may not be true, but it's okay if they're not as perfect as, you feel like you could do. Uh, they're doing the best they can, as long as, it's not an abusive, obviously, situation or neglect. Um, and there's lots of help out there. You don't have a lot of advance warning when you're in this situation usually. Usually your loved one's in the hospital and it's time to go discharge, and it's like, well, you either go to a nursing home or you go home. And, maybe your insurance, most insurances don't pay for nursing homes. I learned after my husband died, I looked into a long-term care policy for myself in case I was ever in this situation,
Mhm.
needing the care. And what I learned, because I was 62 when my husband passed away, that the insurance agent wouldn't sell me a policy. He said that the average person needs long-term care in the middle 80s, and that you can only get a maximum of 250,000 worth of
Oh,
benefit. And the
yeah.
premiums that I would start at 62, I would pay more money than any benefit I would receive. He said I was too young to buy a long-term care policy.
Mhm.
By the time you're old enough to buy it, you probably can't afford it if you're already on a
Yeah,
fixed
I didn't
income.
know that. So, I
Yeah,
mean, you just gave me some information too. I'm always learning
yeah.
something from you. It's wonderful.
So, but, sometimes, there's resources with your local church. There's volunteers that'll come, sometimes, and if people say, you can call me anytime, I'm happy to help you. Honestly, my experience is when you really need them, there's an excuse. There's a few real good friends or people you can count
Mhm.
on. I had a relative, a close relative of my mother-in-law, when I asked him just to come for 4 hours and sit with her so I could go to my kids' swim meet. The reply that I got, and it was one of her other children, "If you can't leave her alone for 4 hours, she should be in a nursing home."
Yeah,
And that
put a
just it
lot to
made
it.
me angry. I just doubled down and, was gonna
Mhm.
prove to
And
everybody that
most
I was superhuman.
Right, and most of us,
So,
you had that nursing training, thank goodness, but most of us at-home caregivers had no training at all with certain things like medical tasks and mobility, moving them and changing their briefs and things like that, cognitive dementia, confusion, personality changes that happen in the situation, and emotional regulation during crisis moments. And, sometimes it's good to have outside caregivers come in, especially if or even pay a few times for not an RN necessarily, but an aide to come in and have her show you some of these little skill things, these little tricks of the trade. It's amazing. I learned so much from the people that came into my house to help me with my mother and when my pops was passing away. And oh my gosh, so valuable. I needed that. I wish I knew it beforehand, but you know, it's an
uh,
option.
but most people don't know it beforehand, and we'll be right back. We're gonna take a brief break.
What if there were a super tiny device that could diagnose the brain and is smaller than a single human hair? What if you could see inside the brain to help an epilepsy patient during surgery or to help the fight against Parkinson's disease? Dr. Patricia Broderick is proud to announce the Broderick Probe, a biomedical and electronic breakthrough. Imagine a probe to help with the understanding and potential cure of brain-related diseases. To learn more, listen live to the Easy Sense radio show with host Dr. Broderick. And to help support the Broderick Foundation, please go to EasySense.com and learn how, with your help, we can fight these horrific brain disorders. That's EasySense.com to learn more and help support the Broderick Foundation. Author, radio show host, and coach John M. Hawkins reveals strategies to help gain perspective, build confidence, find clarity, achieve goals. John M. Hawkins' new book, Coached to Greatness: Unlock Your Full Potential with Limitless Growth, published by iUniverse. Hawkins reveals strategies to help readers accomplish more. He believes the book can coach them to greatness. Hawkins says that the best athletes get to the top of their sport with the help of coaches, mentors, and others. He shares guidance that helps readers reflect on what motivates them, rediscover and assess their core values, philosophies, and competencies, find settings that allow them to be the most productive, and track their progress towards accomplishing goals.
Hi, everybody. Welcome back to our segment on caregivers and how to prepare yourself, what to expect, how to take care of yourself. Um, Gloria, did you have any advance warning or anything? Did you always plan that when you're in this situation, this is just what you're going to do, or did you have options?
Well, I'm a family with quite a few kids in it, but I was the youngest, and I was told by one of my siblings, well, we always knew you were going to be the one to do it. It's like, huh? What? A lot of times it falls on one person, and I was in that situation. I have a brother that tries to bring things and help with things, sometimes, and it's just they don't understand it's an around the clock scenario. So we need to talk really about respite and rest, making sure you get enough rest, and the weight of guilt when you have somebody else take care of your loved one. Normalize this truth. Guilt is one of the heaviest burdens that caregivers carry. I know I do from time to time, and I just remind myself I'm not guilty. They're with somebody very respectable, and they can take care of them for this amount of time. And I've been really wowed by some of them, which is fantastic. But many people like myself think, from time to time, if I rest, I'm abandoning them. Or if I ask for help, I'm failing. If I feel resentful, I'm a bad person. But you need to reframe that. Respite actually is medical prevention, emotional survival for us, and ethical caregiving, especially if we're talking skilled workers. These workers that come in, they are trained in everything from Alzheimer's patients, and these are regular caregivers, not CNAs or RNs. They are regular, just caregivers, and they're trained a whole list of about 21 things that they have to go through all this training and take a test in each of the sections. It's phenomenal how much training they have. But exhausted caregivers make unsafe decisions. I know I've caught myself making unsafe decisions before, and I had to stop myself and like, whoa, wait a minute. I know I needed rest. Types of respites, that's another thing. We have in-home respite care. I do those sometimes. There's also adult day programs outside of the home, or short-term facility stays. I have a nursing home across the street, I can go over there and say, hey, can you take my mom for a couple of weeks, and got to work it all out, see if insurance will cover some of it, maybe Medicare, maybe not. It all depends what the situation is. Family rotation systems, if you have that, you're very fortunate, but use it if you have it, even if it's just for once a week. Everybody comes in once a week for a day. Can do it at your house or take them out somehow. It all depends what their patient is capable of. But spiritual and emotional respite, being a part of counseling groups and support groups. If you can't get out to do it online. This is wonderful. We're in an age of technology. There's so much we can do with it. And rest, you must consider this and actually tell yourself, rest is not a reward for finishing caregiving. It's a requirement for continuing what caregiving you can give. So that's.
And I think I'd also like to interject. I can tell in my experience of 45 years of nursing, I have seen many, many times where the caregiver passed before the long-term chronically ill patient did.
Yes.
That
I
happens a
felt like
lot.
that before. Yes, I felt like that.
know,
I mean, I was with my pops when he was going through the 6 months of not being able to get up out of bed. Okay. And so I was using that Hoyer or the hoist, and I was
Mhm.
using wheelchairs, and he could only sit up for like 10 minutes tops. And, 6 months jumping up in the middle of the night to every like hour, even if, because he wanted me to be around him. So finally I put him in the living room on one of the special medical beds, and I love those are fantastic. And I was sleeping on the couch right by him because I just couldn't handle the getting up all the time. But if he opened his eyes, he saw me and he didn't wake me up. So you look for different options. Ask other caregivers, what tricks can you tell me? What can I do here? And it helps you to get more sleep, a little more rest. Maybe not totally, but that's where the other caregivers, I do pay out of pocket for some of those caregivers. I did go through the state. They do have certain caregivers that come in through the state where the state pays. And then I have some of the other caregivers we have to pay for, obviously. And, each region, it's going to cost a different amount. But, I need that to be able to do things like this. I need that for me to live my life the way I'm meant to live it outside of me being a caregiver. So this is what I do, things like this and all my research. And, I get phone calls, I take the calls, and sometimes I'll call you in 20 or in a meeting or something. You need to consider all of it. It's all part of it. You need respite. You need time for yourself. Getting a hot bath is really hard nowadays, or a shower, but you have to set that time aside. You need your showers. You can't stay clean yourself if you're not taking baths or showers, So there's just so many things that I've dealt with, and it's not an easy task. But if you sit down and map things out on paper, what can I do with this schedule? Is there an actual schedule? Can I keep a schedule? Sometimes you can't, sometimes you can. But if you have a basic schedule, it helps. And then you can see, when can I rest? When can I sleep? Like a newborn baby, you sleep when the baby sleeps. Well, that may be a possibility, but maybe not. So you need to come up with other alternatives. Be creative, talk to other caregivers, talk to at-home caregivers, and look for support groups.
With my mother-in-law, like I said, my children were young. We had paid for in advance a trip to Disney World like a year before, one of the cruises. And then my mom was suddenly living with us full time. And we actually did go to a local nursing home. Uh, Medicare paid for parts of the skilled, the doctor wrote a script for physical therapy, for just improved, transferring of things like that. And we took our 2-week vacation. My mom took a vacation at the nursing home, and it was one that I had researched and actually had worked
There
at
you
in the
go.
past. And that just meant so much because everybody was feeling cheated in life, because of my mom. Yet they felt guilty. You shouldn't have to feel guilty, but you do. It's a human emotion, and you feel guilty
Mhm.
for the kids that it's. And like, I was shocked when my daughter said, "No, I'll put you in a nursing home." It's like, well, what did I do wrong? Why does she have this feeling? And I kind of remember, because my adopted parents were from European background, almost growing up with a sense that not only was it the child's responsibility, there was a time maybe during my rebellious adolescent that I felt the only reason they adopted me was so I could take care of them in their old age. And that's just the way society had looked at things back then. Obviously, I learned a lot more. With my husband, we went through the local county senior services. They came out and evaluated to see, even if he was only eligible for maybe 10 hours a week of help, that was a help for me that I could plan on doing something else, or working hours,
Mhm.
or sleeping even. It's okay. Um, but there are also options, sometimes referrals, people that have used caregivers in the past, private ones that, are the referrals, or, I'd let them take care of myself if I was in need of somebody. You don't always have to, you have to do your research and your background checks, of course, but it doesn't always have to be as expensive as it seems. And, if your loved one has any funds, that's why they have funds. That brings another thing. If you have a relative in this situation, make sure that the power of attorneys are taken care of. Make sure living wills
Right.
are, because chances are they're going to pass at home. You don't want, all the paramedics and all the bells and whistles when that wasn't what they would want, or would be humanely, reasonable for their diagnosis. And a lot of people don't call hospice as early as they should. Hospice does not mean I need help calling the undertaker. My husband was on
Right.
hospice 18 months. What that bought for me was I had an aide come 3 to 5 times a week, for a couple hours at a time, but to bathe him, get him freshened up, things like that. I had another skilled nurse keeping an eye on him, checking him, so it wasn't all on my responsibility. And and that is those hospice services are covered by Medicare. What hospice doesn't pay for is the actual residential in a facility, whatever would normally pay, whether it's, uh, they're, if they're on a state medical program, insurance program or whatever, uh, or, if they have some funds, you save your money so that you can take care of yourself when you can't work anymore. Uh, it's not a people assume, well, if they spend my money, then I had nothing to leave them. Well, the best gift you could give them is get them some help to take care of you if you can afford it. So
Right.
there's a lot of ways of looking at this. Um, but you have to just reach out for help if you're feeling, you have to learn to be aware of your feelings. We've talked about that in other shows, and reach out for help if you feel like, because it's kind of like, if you're really burned out taking care of a problem child, you reach out for help. You wouldn't think twice
Yeah.
about that.
Right.
Uh,
And you can
the
find other people outside of the home, perhaps, maybe
the
even
pri-
if it's just for 2 hours.
Right. The primary care doctor can be a big help because they can order home physical therapy that is not
Hmm.
necessarily to make them walk again if they lost that skill, but to help the family transfer safely. And, they teach
Hmm.
you regular lifting properly, without hurting your back. Um, and that's where, and when you have home care, you usually get an aide at least 3 times a week to also come in. And that's where you learn like a lot of the unprofessional, professional ways of dealing with the hands-on care.
Yeah.
Um,
And
I've
just
learned so
ask. They'll
much.
show you
Yeah.
how things are
Uh,
done.
and it's like, yeah, how do you do this with no other people in the house to help you? Well, they show you
Yeah.
how because, when you're in a facility, you've got help, but you don't at home. So, and the online resources are just wonderful. Um, we're going to take another break and come back for our third section. Um, and we'll talk a little bit more about what's out there for you. We'll be right back.
Author, radio show host, and coach John M. Hawkins reveals strategies to help gain perspective, build confidence, find clarity, achieve goals. John M. Hawkins' new book, Coached to Greatness: Unlock Your Full Potential with Limitless Growth, published by iUniverse. Hawkins reveals strategies to help readers accomplish more. He believes the book can coach them to greatness. Hawkins says that the best athletes get to the top of their sport with the help of coaches, mentors, and others. He shares guidance that helps readers reflect on what motivates them, rediscover and assess their core values, philosophies, and competencies, find settings that allow them to be the most productive, and track their progress towards accomplishing goals. Did you know that your beliefs create your entire reality, but it's the subconscious beliefs that do most of the creating? Belief shifter and life coach Shiraz can help you identify those limiting beliefs and eliminate them, often in a single session.
Like it was almost instant. Like I had relief right away.
Creating better health, relationships, careers, and finances. Let Shiraz help you step out of safety and into awareness.
Definitely something's happening. It's like a flow inside. Yeah, it feels good.
Whether in person or online, Shiraz provides personal coaching, belief shifting. Visit Shiraz at energeticmagic.com or call 416-529-7429. Energetic Magic. Find your greater happiness. Be well. Be aware. Be magical.
Hi, welcome back to our show on caregiving. Dr. Gloria Warren is going to talk to us about caregiver limitations and, how to
Yeah,
recognize some of those signs and what to do about it.
we need to know when we can't and being honest about it. So when I can't do more. So caregivers are limited. There's always limitations. It all depends who you are and what you're capable of, but at the same time we all have some physical health scenarios when that we're dealing with ourselves when we're watching and taking care of others. Emotional resilience, we can shut ourselves down or we can get over emotional. We need to recognize those as symptoms. And financial resources, that was a problem of mine initially with my mom, but however, I have medical, I'm in charge of her medical, and my brother's in charge of the financial. And now he knows that he needed to loosen that up so I could pay for outside caregivers to come in and help as needed. So time is another big thing, and skill level. I learned so much, like I said, from the caregivers, especially the CNA. Phenomenal. How to change the briefs using the chuck underneath. That's that little pad that they have underneath. And I saved my back thanks to my caregiver for him. Personal trauma triggers, a lot of things that it brings up a lot of past life regression or current life regression back to a childhood when you're taking care of a parent because you may have some ill things that keep surfacing or maybe things you need to have review on emotionally and through your memories. These are things, there's processes involved people don't talk about. But the key teaching moments here are that there are caregiving tasks that require teams, not individuals. You need a team to show you. You need a team here and there to help you or to at least take over from time to time. And admitting your limitations is advanced self-awareness. It's not a weakness. It's actually a very good trait inside of you if you can make it come to the surface and be more self-aware of what you're capable of and what your limitations are. And chronic caregiving stress, which often manifests as autoimmune flare-ups, hypertension, insomnia, depression, and hormonal imbalance. So I, in fact, have an autoimmune situation that my immunity keeps dropping, and that's from exhaustion, and it's a key signal to me. So and my life has changed drastically over the last few months because of it, and I'm making sure that I'm changing that. And especially in the new year, I'm changing that. I'm getting more caregivers, doing less myself, and that's something I have to do too, because for me, because a lot of times the caregiver does pass before the person they're caring for, and I don't want to be like that. I have a family and kids, and I want to be around for them.
Another communication, I think, is critical, both
Hmm.
with people, family members, and with the person who is bedbound or in need of care. We're all going to be at that stage in our life at some point. And I remember one house I went to talk to a family about considering hospice. And as I walk in the house, the daughter says, "Oh, before you meet my mom, please don't tell her that she's dying." And then I walked into the bed. I'm thinking, okay, that's a clue for this family here. I walk into the bedroom to meet the patient, and the first thing out of the mom's mouth is, "I don't want my children to know I'm dying." And I went back out with the family and I said, "Hey guys, we need to have a quick family meeting here so we're all on the same page." And
Hmm.
it's such a relief to be open about the communication. Dying is a natural stage of life. Some people, unfortunately, it's a longer process than others. And, it's not something we have control over.
Yeah.
Um, and I remember one time with my mother-in-law, and she just had had enough. Dialysis was, just killing her. The fact that she had no legs, she was only in her 50s, she was blind, she was totally dependent and just felt so bad about it. And she kept on saying over and over, "I wish I was dead. I wish I was dead," which it bothered me because I was trying to protect my children from that. I didn't want them to
Hmm.
be exposed to that. I understood what she was going through because I was a healthcare professional, but my ex-husband and we were, only married about 10, 11 years at that point, one of the times he had just been so burnt out that he snapped back, "Well, stop talking about it and just do it." And I was like,
Mhm.
"Oh," but that happens more often than you think, it's because you're not taking care of yourself and you're not, you're like you would try never to snap like that with your children, but it's human nature sometimes and things come out. It doesn't mean that you're a bad person. Yeah, it just means, okay, that's a sign, a big flag. You need some help right now. Uh, they have
Biggest
support
sign of
groups.
burnout.
It's a big
You
sign
know?
of burnout, and it's even sometimes it's enough just to take a spa day for yourself, get somebody in for 6 or 7 hours while the kids are at school if you're in that age group, and just have a day for yourself or go out to lunch with a friend. Don't isolate yourself because when you isolate yourself, you're just compounding the risks and putting both you and your loved one in danger. Um, what else would you like to say about this
Oh,
topic?
burnout's not a failure. Everybody goes through burnout from time to time if they're an at-home caregiver. I'm sure I've gone through it many times. Now I have somebody else living here too, and the blurting out of things that are just nasty sometimes because of what they're putting up with. And me, I'm just, I go with the flow. I'm pretty much a very go with the flow type of person. And I'm normally a very happy go lucky person. So to hear a pessimistic attitude, somebody like that, it was more difficult for him to actually deal with some of this. But I'm not like that. I'm very optimistic and I try to be happy, like a Mary Poppins type of thing when I can. But even I've suffered burnout. So maybe from the added pressure or even some of the pressure that just comes and goes. So it's the nervous system's alarm that's support, and it's saying I'm overdue. I need respite. So it's a state of physical, emotional, mental, spiritual exhaustion, and it's caused by prolonged caregiving stress without adequate relief, support, or boundaries. Can be
And I think
slowly.
when when we get to the stage where I mean, and we all get there,
Mhm.
and sometimes you get there 3 or 4 times in the process, we don't count that. It's a
Right.
sign to take better care of ourselves. But what I wasn't expecting, even being a healthcare professional, I didn't expect the feelings and the sense of depression and the void that was in my life because 24/7 I was taking care of my mother-in-law. All of a sudden, she had transitioned to the next world, and I was lost. Even though I had 4 kids to take care of and, I could get back into work and things, emotionally, I was just lost. I didn't know, you know, how to fill that spot. I wasn't expecting to be depressed. Uh, and at the
Mhm.
same time, if you have feelings like, "Oh, thank God it's over," that's a normal feeling too. Don't feel guilty about it, because it's not just thank God it's over. It's like focus on the gratitude. I'm glad they're not suffering anymore. And,
Yeah.
and see what you can do to check on everybody else because moms are often the ones that have to be responsible for everybody's emotional status, unfortunately, even though it shouldn't be that way. That's just reality sometimes. Um, and there's little things you can do. 5-minute yoga exercises, meditate, even if it has to be when you're in the bathroom multitasking, taking care of yourself and, um,
Mhm.
it just you have to just acknowledge that you have limitations and remind yourself of how important it is to take care of you. And if you have small children or other handicapped people in the home like you do, um, you can't be everything to everybody, but just
Right.
be aware that, what the general environment is like. It doesn't
Yeah.
mean, you mentioned that you like to be happy and positive and all that. Well, that's not entirely human either, so
I
you're
know.
not
I think it's my way of my
expected. Right.
personal respite in my own little mind. I've always been a laughing type of person. Um, and I remember my dad, he'd say, well, how can you always be smiling? He goes, you don't have a penny in your pocket or a window to throw it out in. And yet I just have a very optimistic way of life, and there for the grace of God go I, and I go. But I still have to look out for those early warning signs, the fatigue, even after I've slept, emotional numbness, loss of patience, feeling on edge sometimes. Oh, yeah, difficult concentrating, withdrawing from family and friends. I think that's my biggest cue because I just want to stay at home, not go anywhere. And then I know, whoa, I need to get out. And that's why I got chickens, actually. You know, you were mentioning after somebody dies, I think you mentioned after the person goes away, don't feel guilty. And, that wasn't my problem. What I felt was I would still hear in the middle of the night, Lord, and I'd pop up and run into the other room and I realized he's no longer there. And I would still be going through this transition. It took like 2 to 3 months before my brain accepted the fact that he was gone. And it's just, different people mourn in different ways. And that was my way of not wanting to mourn, not wanting to accept it or realize it deep down depths of my psychological soul. And I didn't get the emotional detachment. I got the emotional overattachment scenario. So it's not, it's not, it's something everybody goes through, but they may go through it in different ways. So realize that whatever way you're going through it, it may not be the same as somebody else, but you want to try and figure out how to pass this. And maybe you're denying, is self-denial that they're gone because you've been doing it so long. So you need to find your joy, find your sense of purpose now in life, because your purpose is different after they're gone. So,
I think it's also important, though, to allow yourself to grieve. And,
yes.
there's something we talk about in healthcare, anticipatory grieving. If we know that we're going to have that end coming sooner than we would like, sometimes you're grieving before you get there. And if you're fortunate enough, and sometimes it feels like a burden, but if your loved one doesn't have dementia and still has all their faculties and they want to talk too, they're afraid of it maybe. And if everybody's not, talking about the big D word, but like I remember one lady, she was a matriarch of a family of like 9 children. The day she signed on hospice, she bought what she
Mhm.
described as her traveling clothes, the clothes she wanted to be laid out in. She was a remarkable woman. And a year later, I was with her on what I knew was going to be her final day. She asked me to bring her pocketbook. Her family was in the other room, just kind of waiting. And I gave her pocketbook. She took out her checkbook and wrote out a bill to the cable company. And my mouth dropped open. And she said, "What's wrong?" And I said, you know, we both know you're not gonna be here for dinner, and you're worried about paying the cable company. I said, "I have to be honest, that's not on my bucket list." You know? And,
Right.
uh, and she said, "I don't wanna leave anything undone. You guys have taken care
Eye
of
of the
such
ends.
good."
Yep.
And,
And we can help them do that. We
and so
can
it's
do,
good.
sorry.
And one day she said, "Why am I still here after all this year?" And I said, "God has to warn everybody you're coming." And she smiled. "I like that. Okay, I can wait a little longer." Um,
I like
we're gonna
that.
take another break and, a few closing words, which will leave on a positive, uh, impact. We'll be right back.
Are you struggling to care for elderly parents or a spouse? Do you wonder if being a caregiver is making you sick? Are you worried about taking time off work to care for elderly parents and balance work, life, and caregiving? Has caregiving become exhausting and emotionally draining? Are you an aging adult who wants to remain independent but you're not sure how? I'm Pamela D. Wilson. Join me for the Caring Generation radio show for caregivers and aging adults, Wednesday evenings, 6 Pacific, 7 Mountain, 8 Central, and 9 Eastern, where I answer these questions and share tips for managing stress, family relationships, health, well-being, and more. Podcasts and transcripts of the Caring Generation are on my website, PamelaDWilson.com, plus my caregiving library, online caregiver support programs, and programs for corporations interested in supporting working caregivers. Help, hope, and support for caregivers is here on the Caring Generation and PamelaDWilson.com.
What if there were a super tiny device that could diagnose the brain and is smaller than a single human hair? What if you could see inside the brain to help an epilepsy patient during surgery or to help the fight against Parkinson's disease? Dr. Patricia Broderick is proud to announce the Broderick Probe, a biomedical and electronic breakthrough. Imagine a probe to help with the understanding and potential cure of brain-related diseases. To learn more, listen live to the Easy Sense radio show with host Dr. Broderick. And to help support the Broderick Foundation, please go to easysense.com and learn how, with your help, we can fight these horrific brain disorders. That's easysense.com to learn more and help support the Broderick Foundation.
Hi, welcome back. There's a time sometimes where caregiving that the person at home, the patient, the family member, is her needs are just beyond what you can safely provide at home. Um, and or maybe everybody in the family is so burned out that presents a safety issue too if you're at that stage.
Mhm.
So if you're considering a facility, that's a pretty scary concept, and there's a few things to consider when you're going out. It's important that you at least visit virtually, but it's better if you're choosing someplace close that you can visit, someplace that allows 24-hour visiting. If you're at the
Mhm.
the final stages. Um, One of the things I always look at is how long has the staff been working there? If you have a high turnover, I'm not staying too long to visit too much of the tour. But if you've got caregivers, not necessarily the nurses, but the hands-on caregivers that have been there for 10, 15, 20 years, then you've got dedicated people that know what they're doing and, will take care of your loved one as if it was their own. And you can kind of get that sense when you walk into a facility. If it's a facility that has a lot of odors, you know that they're not being taken care of properly. uh, every facility, assisted living or memory care or skilled nursing, on the state websites, long term care websites, you can see their state surveys. If they're on a provisional rating, of course, that may be why their price is cheap. You don't want to be there. Um, but you can see what their deficits are. They have to be transparent about it. Um, and it's important to do that research. You can talk to other people, maybe at your church, and whose family members have been at places, get their feelings.
Mhm.
You have choices. Um, how what their fall rate is. Very, I don't think you're allowed to use bed alarms anymore. That's considered a restraint. Nobody's allowed to actually tie them in bed, thank God. Um, but you're gonna have a lot more falls, and falls, happen
Mhm.
as your mental, if somebody, though, is so confused that they're falling at your house too, you can't be calling the fire department 3 times a night to pick them up, and that's what you have to do if you're at home, and they're used to it. The police and fire, they do that all the time for home care. um, or if they have just so many medical procedures in their care, drains that have to be emptied, wound care that is just overwhelming. You don't know whether you're doing it right. You don't want it to get worse. Those are skilled needs that you you know, and you shouldn't feel guilty about, uh, having to put them in something like that. If there's infection control issues that would expose, the rest of your family, that's always a consideration. You don't want to put the rest of the living at risk because somebody's got something that really is more medically challenging. Uh, and dementia is one of those diseases. We've talked about it on other shows. It's more painful for the caregivers. My husband had dementia at the end. No matter what I said to him, it was, "Oh, okay." He was happy-go-lucky. He didn't understand anything I was saying. He didn't know that he didn't have his mind anymore. Yet, there were days that if I visited him and I was wearing nursing scrubs, he thought I was one of the staff. It took him 5 or 10 minutes. "Oh, Peg, you came over," but he didn't recognize me right away, and that's very painful. It doesn't mean you failed in some way. He wouldn't recognize you even in your own bedroom. My nana didn't know who I was living with us 24/7. That just, uh, you should know what the medical things are that you're dealing with when you're in that situation.
Mhm.
Um, Gloria, would you like to, say a few
Yeah,
words.
yeah, when you consider, and it runs through your mind perhaps about, should I put them in a facility? I'm really getting too burned out. I'm getting sick, or whatever your reason is. You got to think, what would happen though if I became ill or unavailable tomorrow, or maybe Lord forbid I have an extreme accident and I can't take care of them. So you should kind of get an idea, no matter what if something happens to me, where would I put them? Do that while you're healthy, and everything else, it helps to make the transition better. Look at things, and this is what you've always got to say to yourself: I'm allowed to be human. I'm allowed to have rest, and I'm allowed to change my plan as time moves forward. I'm not abandoning my loved one. I'm expanding their circle of care. And that is, I'm expanding my mother's circle of care right here in my home now. So she gets acclimated for other people to help caring for her, so that if I am no longer able to take care of her for one reason or another, she can maybe transition more easily into a facility if necessary. Or maybe it'll be more jousting. Maybe something will happen to me. So there's a lot to consider.
It's a big responsibility, but it's about quality of life for both of you.
Right. You're not required to destroy your own life to prove your love for somebody else.
And
That's
if I
a
had
given.
tried to even have my husband at home and still try to work and things, or not work and then go into, medical bankruptcy or something, you have to just look at all your options and accept where you are in life and what's best for everybody that's involved in the picture. Um, so if anybody would like to reach out to Dr. Gloria Warren or myself with questions on our YouTube page, we will help you. I have resources across the entire country, that can help find what you need in your area. Um, and even if you just need a little bit of emotional support, to double check that, usually listening to your gut is the best thing to do. Um, so
Mhm.
just like to thank everybody for joining us today. If this has been helpful, please like and share. And Holistic Nurse with Peggy Smith on YouTube, and Dr. Gloria Warren. What is your site? Uh,
Medicalintuitivegloria.org.
and
Hmm.
uh, thank you, everybody. Stay safe and healthy, and don't be afraid to ask for help. Uh, in any situation that you're in, it's not a failure, and sense of a lesser person. Thank you for joining us today.
This has been The Holistic Nurse with host Peggy Smith. Tune in each week where you're encouraged to send in questions and receive private responses and suggestions if appropriate. Thursdays, 1 p.m. Eastern.